Alright team, here are the symptoms we're dealing with. Cellulitis, photophthalmia, and duodenal lymphocytosis.
I think it could be an infection, maybe related to the cellulitis.
But what about the eye sensitivity? Photophthalmia could indicate a different underlying issue.
I'm leaning towards a gastrointestinal problem with the duodenal lymphocytosis being present.
I'm not sure about any of those. The symptoms seem all over the place.
Of course, they seem all over the place to you. It's been several goddamn months and you still refuse to buy a new pair of glasses. It's keratolytic winter.
But that's so rare. Are you sure, Hawks?
I'm the doctor here, Gary, and I say it's keratolytic winter. Erythema. We don't have time to waste with doubts.
What's the treatment, Dr. Hawks?
We must perform Hartman's operation.
But that's a risky procedure, Doctor. Are you sure that's the right move?
I've made my decision.
We're going ahead with Hartman's operation. It's our only chance to save the patient's life. Now scrub up and let's get to work.
Tracy, I need to talk to you about performing Hartman's operation on my patient with keratolytic winter erythema.
Why do you need to talk to me about it?
Actually, I guess I don't. Thank you. I've got idiots to yell at. They probably botched this operation too.
Oh no, the patient is in critical condition. We need to act fast.
I can't believe it. Dr. Hawks insisted on the Hartman's operation, but it wasn't the right treatment for keratolytic winter erythema.
We should have questioned the procedure earlier. Now we need to figure out the correct treatment for the patient.
We did, but Hawks got mean and took it out on Frank for once.
Probably because Frank has been unusually quiet this year and just wanted to make sure his life was still a living hell.
What the hell were you all thinking? Nearly killing our patient with your incompetence. Keratolytic winter erythema, my ass. And performing Hartman's operation? Are you all morons?
I think that makes you the moron, Hawks. You came up with that idea yourself and demanded we do it. Get your own goddamn pair of glasses. If you cannot see the forest for the trees.
You didn't see this coming?
I don't know what the hell Frank's on about. What about the rest of you?
I don't know what Frank is on about either. I reimbursed him for the glasses I dropped from the roof months ago.
I'm talking about the patient.
Like we should ask for their contacts to help you or Frank out?
Don't get fresh with me, Leslie. I'm asking, how do you make such an incorrect diagnosis and choose the wrong procedure?
We listened to you.
Randall, all four of you are pissing me off today. We have a patient that is critically ill, and you're so fixated on Frank's shitty eyesight, I'm convinced I'm on some sort of YouTube prank channel.
But without all the talent of a YouTube prank channel.
That's redundant.
We're sorry for the mistake, but we need your guidance to fix it.
You're lucky I even bother educating you fools. I swear, this case has been driving me crazy. Nothing seems to add up.
I get what you mean, but the oncology department is doing quite well. We're seeing some progress with the new treatment protocols.
Sorry to hear that. Anyway, something about this patient just doesn't sit right with me. Wait a minute. I think I've got it. It all makes sense now.
Really? What is it?
Hartman was wrong all along. I must stop that dastardly fiend right away. So long.
Why does he get to do all the cool drugs? I hate my job.
Sorry for the interruption, but we have a new diagnosis to address.
Hawks put some protective gear on before busting in here. That's a serious breach of protocol, you know that.
You're putting everyone at risk, not just yourself.
What's going on, Hawks? What's this new diagnosis you're talking about?
Keratolytic winter erythema was a misdiagnosis. It's actually hereditary spastic paraplegia.
Hereditary spastic paraplegia? What's the prognosis?
Is it treatable? Can we manage it effectively?
Hawks, tell us. What's the deal with hereditary spastic paraplegia?
The prognosis for hereditary spastic paraplegia is not good. It's a degenerative condition with no known cure.
So how is this Hartman's fault?
We never speak that man's name in this hospital again. He knows what he did, and he must pay. Tracy. I've come to admit I was wrong about the diagnosis. It wasn't keratolytic winter erythema. It was actually hereditary spastic paraplegia.
That's great news, Hawks. Congratulations on finding the right diagnosis for the patient.
Thanks. It's amazing what we can find when we have competent doctors like Dr. Johnson.
What did he have to do with anything in this case? He's in an entirely different department.
Sometimes other departments have what others may lack. He has brain skills, proper uniforms, he's Gary-free, etc.
So he should be the one getting the credit for this.
Well, no, I'm just suggesting maybe one Johnson is better than 4 idiots.
Did you come to that conclusion on your flight to Vegas a few months ago?
I have no comment.